occipital position. All right? So now your hands are going to be here. Do a 15 degrees cranial rotation. Keep that anti-rotation, keep it there. Now hold your head in that position against the TheraBand and gently now raise your hand towards the ceiling without moving the head. Okay, go up, 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 up. Hold it in that position. Hold, 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 hold. That's a very strong extension activity. So you have to control that. Get the TheraBand very long. All the way, all the way, all the way, all the way, all the way. Okay. Gentle with finesse. Okay, now stretch your arms up. Hold that position. Stay in that position. Hold it for 6 seconds. And she's trying to hold the head back. And you can feel the muscles working in the back of the head for control. And relax.
That's
and
still
let go.
contracting.
Right. But she can control the amount of activity. Can you feel the extension of the head?
I can, feel
A lot around. So there's a lot of activity going around the head. Do it again. Gently. It's South Dakota, What kind of blood do you have?
thick.
And let it go.
In what diagnoses patients am I doing this with?
All the patients that you think that the cervical spine, that you need to restore the cervical lordosis. All right? Now, once you've done, and you're getting to the stage of the resistance of extension, always holding the cervical spine in lordosis. So if you don't have it floaty, put a cervical roll or put anything that you can put in between. Don't forget that the area of lordosis, the depth of that lordosis is usually between 6 to 8 centimeters. So we're talking about probably 3 inches. So the floaty should not be more than 3 inches high. That's kind of an average. Could be a little bit less or a little bit more, but that's kind of the average. So you always keep it on the cervical spine, so it will keep the cervical spine in that slight extension. So when I always say we're going to do extension, when we talk about extension, we talk about normal. Because the cervical spine is an extension curvature. The lordosis is an extension. That's when you have extension, which is actually a mild extension of 6 centimeters or 8 centimeters of depth of that curvature. That's where you will find that the vertebra above is functioning in the posterior third of the disc, and the facet joints are parallel to each other. And that is neutral. Anything beyond that back is hyperextension. So when we're talking about cervical spine and we say extension, we're talking about into a neutral, normal position of the cervical spine. If I'm in the thoracic spine, that's flexion. Now I'm doing extension. But on the cervical spine, extension is normal. Everything that you do beyond that point is hyperextension. So I say I'm going to keep you in slight extension with the cervical lordosis, and I want you to do, this is going to be around your occiput, there, and gently lift your hands 1 inch. Relax and let go. And she holds it maybe for 6 seconds. Okay, lift your hands 2 inches. And hold. That's a lot of muscle activity around the neck. So you don't do this on day number 1. You do this as progressive. Probably the patient has passed maybe 3 or 4 weeks in your practice already. So you're getting to the end. And finally, what you have to understand is that while the patient is here, this is where your hyoid bone is. It's very flexible, very movable. So you can do a little of mobilization. You can kind of hold the hyoid bone with the finger and maybe do a little bit of stretching of the infrahyoid muscles. Just hold the hyoid and mobilize laterally to the cartilage towards the sternum. That's where the infrahyoids are. or you can hold the hyoid and stretch the suprahyoids. And then you go back here again.
So the pharyngeal muscles specifically, like middle and the inferior, where do you find?
Those are deep back in here
Okay.
at the end of the vertebral body. These are laterally in front of the pharyngeal muscles,
Okay.
more
Can
superficially.
you palpate, like, can you actually get in and release the pharyngeal muscles? Or
Well, you can palp them laterally through here.
Mhm.
That's the pharyngeal muscle. The longest colli is in the middle, and the pharyngeal muscles are lateral.
Okay.
So you palpate between the cartilage and the sternocleidomastoid muscle, right through there, or right through here. Now, you're gonna have problems explaining to your husband where you get all those bruises on your neck. So, anyway, what we're trying to do is to balance paravertebral with prevertebral and inframandibular muscle activity. And when we start working with these patients, don't forget to always finish with a little bit of distraction, maybe 15 degrees of cranial attitude rotation before they leave, just to kind of relax everything. Make sure that she doesn't lose the side bending of occipital on C2-3, and that is proportional.